Can I exercise with a heel spur? That's a common question that a lot of active people have when they start to have heel pain, especially if they've been diagnosed with a heel spur on their x-ray. Because when you can't do those activities that you enjoy, it kind of almost makes you feel depressed. Well, the good news is that you can exercise with the heel spur. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain what exercises are safe to do with the heel spur, what exercises you should probably avoid, as well as some exercises that you can use to relieve your heel pain so you can get back to your normal exercise routine. Now, first of all, what exactly is a heel spur? Well, there are two different types of heel spurs. You can have a heel spur on the bottom of your heel that's more typically associated with plantar fasciitis, and you can also get a heel spur on the back of your heel, which is more commonly associated with Achilles tendonitis or Achilles tendinopathy. And both of those heel spurs are caused by the same sort of mechanisms, and that's an abnormal pull of the tendon, whether it be the plantar fascia or the Achilles tendon, on the bone. And that's essentially what bone spurs in general are. They're your body's normal response to an abnormal force. And what that means is that if a tendon is pulling awkwardly or abnormally on a bone, your bone is going to lay down more bone in order to build it itself up stronger to withstand those forces that are placed upon it. That's a principle known as Wolff's Law, that your body's going to lay down bone where it's needed in response to the forces that are applied to it. And so the way that you fix a heel spur is to fix those abnormal forces that are applied to it. And we'll get to that a little bit later on in the video about exercises you can use to apply more normal forces to your bone. But in the meantime, while you're healing from a heel spur, what exercises can you do safely? Well, largely you want to avoid exercises that are going to be very high impact. Things like running will put a lot of force right on your heel, especially if you tend to run with more of a heel strike. Additionally, jumping or landing with high forces puts a lot of tension on your Achilles tendon. And so temporarily, those are activities that you want to avoid if you have a heel spur, either on the bottom of your foot or on the back of your heel. But you can engage in activities that are low impact or that don't cause you pain. And so biking is a great example. Exercise biking allows you to get blood flow to your tendons, which your tendons need. Tendon tissue is largely avascular, meaning it doesn't have a great blood supply. And complete rest from activity actually makes tendon problems take longer to heal. Tendon problems like Achilles tendinopathy or plantar fasciopathy, both of those need activity, but again, not high impact activity in the short term. Now, other things like walking are good exercises. If you happen to have pain when walking, wearing good shoes with good arch support, particularly people who have heel spurs, especially on the bottom of their heel, tend to have higher arches. And that's good in the fact that higher arches don't usually allow you to pronate too much and overstretch your plantar fascia. But the bad part about that is that if you hit on your heel, you get a much more pinpoint pressure because the force is just distributed on the back of your heel and on your toes and not as much across the middle part of your foot. So if you do have high arches and you want to get back to walking comfortably and eventually back to running comfortably, it is a good idea to get orthotics or inserts to put in your shoe. But you don't want the hard kind of orthotics because if you're already getting too much pressure on your heel, putting something hard in there is going to make it even more uncomfortable. So typically with a high arch foot, or if you do have heel spurs, you want to fill the gap inside your arch with a soft, accommodative, padded orthotic or like a gel insert that has a high arch, something that's going to take up the space in your arch without causing additional pain and pressure on the heel. Now, what other exercises can you do? Well, swimming is a great exercise. Weightlifting or any type of upper body exercise is a good exercise. The general rule of thumb is use your pain as your guide. So now what exercises can actually help you if you have a heel spur? Well, again, heel spurs are a normal response to an abnormal force. So you want to fix that abnormal force. Now, a lot of times that abnormal force is some form of overpronation. And I mentioned that a high arched foot typically doesn't pronate well. Sometimes, though, you have toes that are lined up this way with respect to your heel, and your body has to try to get the toes to the ground. And so you can even end up overpronating a little bit with a high arched foot. But what that ends up doing is it puts more pressure on the inner side of your heel. Same thing with your Achilles tendon. If you either pronate too much, it kinks your Achilles tendon one way, or if you don't pronate enough, if you have a high arch foot and you're an oversupinator, you kink the Achilles tendon in the other direction. And your Achilles tendon has strong fibers that are like this. They run parallel with one another in an up and down direction, but they're not very strong crosswise. And so if you start having bending motions like this across the Achilles, it puts it at risk for tear, particularly on that side where it's being stretched. And so in order to avoid either underpronation or supination or overpronation, you want to keep your foot in a neutral position. And so what are some things that you can use to do that? Well, largely just being able to balance your body over your leg is a good start. That whether you're walking or whether you're running, if you can't stand and balance on one leg, it's going to be really hard to control the motion of your foot and your ankle and keep your body stabilized over one leg when you're walking, or even more so when you're running. So just practicing standing on one leg is a good start. You probably can't see it here with the carpet, but I am actually trying to scrunch my toes and lift my arch a little bit to keep the arch from flattening down too much. So kind of curling the toes a little bit, doming the arch and trying to create a high arch foot, and then standing on one leg. If you can't do that immediately, you can hold on to something until you develop your balance. The other thing that's important to know is that your hip strength affects your foot as well. So if your hip is weak, then you're going to end up overpronating as well. So this helps not only strengthen the arch of your foot, but also helps strengthen your hip, keeping your knee from going in that way while you're standing on one leg. Then once you can master that skill, especially if you want to get back to running, you do need to be able to absorb shock a little bit. And so starting to do little small knee bends like that can help you control your foot and ankle position as you're moving dynamically. And so that's another exercise that you can use to help prevent heel pain or help relieve heel pain if you already have it. Now, what about your calf muscles? Your calf muscles attach into your Achilles tendon, and if your calf muscles are stiff, they also prevent you from taking a step when you're walking or running and can create some overpronation. So stretching your calf muscles is really important, but you don't want to allow your foot to overpronate when you are stretching your calf muscles. So a lot of people, when stretching their calves, they'll allow their foot to either flatten out or they'll point their toes out like that. And it is important that you keep your arch lifted when you're stretching and keep a arch in your foot and keep your toes straight ahead. So that stretches your calf muscles without allowing you to overpronate at the same time. Additionally, when you're walking and running, you need to be able to push off of your calves. Now, if you have an Achilles tendinopathy, calf raises are actually shown to be one of the most well-researched exercises for that. But again, if you're going too far one way or too far the other way with your Achilles, that's going to put more stress on your Achilles tendon. So when you are doing calf raises, you want to make sure you're able to keep your calf or your Achilles tendon going straight up and down, not too much pressure on one side of the foot and not too much pressure on the other side of the foot. So keeping that Achilles tendon and heel in sort of a straight up and down alignment. So those are some exercises you can use to help relieve heel pain and help a bone spur to heal. Now, more severe treatments for bone spurs, if you try conservative treatments and they don't work, are shaving down the bone and surgically having the bone spur removed. But most people who have bone spurs in either the back of their heel or in the bottom of their heel. With proper treatment, they don't end up needing surgery. Now, if you happen to be in the St. Louis area and you'd like to be able to be active again and you have a heel spur that's keeping you from doing that, reach out to us at More for Life and we'd be happy to help you. And if you're watching this video from somewhere else but you found it helpful, give the video a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching and have a great day.